is something like creatine okay to put in the mix? You know, like, because there's a lot of things with cancer, and this was a question that I had around the plasmalogens as well. Plasmalogens, I keep saying that wrong. Right. When it comes to cancer models, are they safe to put in the mix? Because things like, phosphatidylcholine, which is really important for brain health, important molecule there. There's some research around not being great to put into someone with cancer. So, what's logically good for somebody who's healthy isn't always logically good for someone who has cancer. And that's been a bit of a, for me, a shift in, mindset in the last year.
It's about timing. Okay. It's about timing. Okay. So the classic concept of cancer is a titration event. Okay. How do I get a therapeutic window? How do I give a human being just enough toxin that it's going to selectively kill the cancer cells, but not the other cells? So there's this therapeutic window concept, right? And there's a certain degree of validity to that. But the other part is cancers are actually healthy cells, right? They're amazingly healthy. They're over healthy. They're very, very selfish. Yeah. Okay. They don't play well with their community. But cancer needs to be contained. Okay, so cancer is like it has to commandeer the following cell and says, hey, look how great I am. Why don't you be a cancer cell too? And let me teach you how to be a cancer cell. And then that one teaches another cancer cell. And so part of cancer is containment. So in terms of reducing cancer, strengthening the cells around the cancer will shrink the cancer. Okay, the cancer has no place to go, right? And so it's a combination. So if you want to do a chemotoxic process, do that for a period of time. Say, okay, you know what? I'm not going to feed the cancer. I'm not going to feed the healthy cells. I'm going to get the chemotoxic agent, let it do its short-term activity, and then feed the rest of the cells, N-acetylcysteine, carnitines, CoQ10, your phosphatidylcholine, the plasmalogens, because now what you want to do is you've hit the cancer and now you want to contain it. And you want to strengthen everything around it, because if the cancer can't grow, your cells will kick it out.
That's just blowing my mind, because
we all have cancer right now. You and I have cancer right now.
You're saying that it's about the timing. So you have a kill phase. So you're going in with a kill phase with chemo, hyperbaric, vitamin C, whatever off-label drug combinations, whatever you've chosen as your pathway. And then when you've gone through that kill phase, like with Mum, we've got a clear MRI now, because I've been, debating this. And this is the tightrope that you walk when you're working with someone with cancer. Is you're trying to feed the person, nourish the person, give the person the right nutrients while not feeding the tumor, and it's this bloody tightrope. And of course, a lot of cancer patients are cachexic, and they're losing weight, and so the general oncologists that you go to in the hospital are telling you to eat your pudding and have lots of energy, have your sugar, and I'm like,
no, fasting.
Yeah, okay. Fasting is much better.
a fasting cell cannot be cancerous.
Yes.
Okay. A cancerous cell, by definition, is a cell that's lost its ability to function in the fasting state. Okay, that is what is a cancer cell. And that's why low HDL drives cancer, low plasmalogens drive cancer. So what happens is, you see, cancer cells don't want to be cancer cells. Okay, they're forced to become cancer cells. They can't survive without being cancerous cells. Okay, so they have learned, they're trying to survive. Okay, they lost their ability to maintain their own homeostasis under regular biochemistry. So typically, the BRCA gene. So they've now taught themselves to they reconfigure the citric acid
fermentation process. Okay? Yeah.
And the peroxisomal function goes down, mitochondrial function goes up. And so they've been able to learn to live in a non-fasting state. And so that's what the BRCA gene does. So for women with breast cancer, the BRCA mutation prevents them from maintaining a fasting state. Okay. And then eventually the cell says, hey, if I don't get sugar, I'm going to die.
Yeah.
So I have to find a way to upregulate my sugar or I will die. So it's not that they want sugar or glucose, is that if they don't get glucose, they die. And so people think that there's some sort of protagonistic approach to it, but it's not. It is actually adaptive. Cancer cells are adaptive. Okay. A cancer does not become cancer, it adapts to become cancer as its only survival option under the circumstances. So health, so I always tell people, look, let the surgeon cut the cancer out. Your job is to recover from surgery. Okay, you need to recover from the chemo. And it's because it's a recovery phase that gives you your good prognosis long-term. We're pretty good at killing cancer. We're pretty good at cutting cancer out. We're not so good at recovering from that work.
Yeah.
Okay. And that's the problem. So that kind of two-phase approach. And then
so it's a peroxisome. So the mitochondria become anabolic as opposed to being catabolic when they're in that cancerous state, and the peroxisome starts to. So you're not getting that building up phase, that recovery. You're not producing the HDLs and the
correct, because
all the plasmalogens and so on.
Because the peroxisome is your typical anabolic organelle. So okay, so when you're in the human body is designed to live in the fasting state. We only eat to put ourselves back in the fasting state. Okay,
Wow.
Purpose of eating is to go into the fasting state. Okay, so fasting is very similar digestion of your fat cells versus your gut. So when you eat a meal, you're in the fed state, but your gut is digesting food and supplies, and it's coming in. It's a rush to the body. You say, there's no way I can process all this energy. So it ships the excess energy in the form of triglycerides into your fat cells. And later on, similar enzymes, lipases, digest the fat in your fat cells and send free fatty acids out. So you're basically replacing your stomach with your fat cells, with adipose tissue. And so when you're doing a keto diet or you're doing these kind of diets, what they're fasting, how they're considered fasting mimetics is because they're treating the gut like an adipose tissue cell. So the same type of molecules coming out of the gut from a high fat diet is identically to what would normally be coming out of it. And so your body thinks and feels it's getting free fatty acids and so on. So that free fatty acid is your energy. It goes into your cells. And then you have two parts of your cells that process it. One is your mitochondria and one is your peroxisome. Like you said, mitochondria catabolic. It's supposed to be just pure energy. Fatty acids go in, get digested to acetyl-CoA, because we're essentially a hybrid electric car. We burn hydrocarbons to charge a battery, and the battery is in the mitochondria. And so what happens then in cancer is that instead of that fatty acid metabolism going to charge the electron transport chain gradient, like the battery, okay, part of it gets cut out called citrate, and it goes out, and then that becomes your building phase, and that's how it builds cholesterol. So cholesterol misregulation is a huge issue. Probably the biggest issue for cancer is cholesterol dysregulation.
Well, I've never heard that before.
Yeah,
That's
all cancer is caused by cholesterol membrane related issues.
Wow.
And so the citrate, and we've known this for years and years, but it's people don't talk about it. So it's cholesterol in your membranes that deal with it. So that's why HDL, people that have high HDL levels have a very low risk of any cancer. So HDL, and that's why your phosphatidylcholine prevents pancreatic cancer, for example. Virtually all pancreatic cancers are derived from choline deficiencies.
So does it switch alliances though when you actually have now a cancerous cell? Does those things that would actually be beneficial then switch alliances? You know, like I've been, some of the research around coenzyme Q10 and acetylcarnitine and phosphatidylcholine as being not good to put in the mix when you've got a cancer cell. But you're saying it's timing,
and because you don't, the overall health of the body is going to have the greatest impact on cancer shrinkage.
Got it.
So if you're hitting the cancer it's, if you have to, what's the point of killing a cancer, shrinking the cancer, if you've left a whole bunch of damage left? And so now what's going to fill in the hole again? The cancer is going to fill the hole back up. Okay.
Right.
So you need to be able to fill the space with healthy cells. And so that's why.
Wow.
Thing is that we all have cancer. The
Yeah.
concept of cancer is when it gets to a certain cell mass that we can actually see it,
Mhm.
and it gets to a certain level that it learns to create its own blood supply, and we can actually see it. But fundamentally, cancer is just an aberrantly growing cell. It happens all the time.
Mhm.
Probably a million times a day, you have a cancerous type cell in your body, and but it doesn't go. It has no place to go. Okay, it's like having a bad, as long as you don't have one bad neighbor on your street, it kind of stays, eventually the person says, there's no fun here. I'm going to go somewhere else where my bunch of other bad people are. Okay. But as soon as you get 5 or 6, then all of a sudden the whole neighborhood goes to hell.
Yeah.
Right. And so what you want to have is you want to have that one guy that's
Get kicked out by the healthy
well,
ones.
and
The good ones.
you want to make it inhospitable for him. It says,
Inhospitable. Yeah.
right. So he says, well, I don't like it here. Like I got no peeps here. So I'm going to eventually leave this neighborhood to find another neighborhood that I want to harass. And so that's kind of what cancer